You are now listening to the Lunch and Learn with Dr. Barry. This is episode number 6.
Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
Welcome to this episode of the Lunch and Learn with Dr. Barry. On today's episode, we're going to be talking about sleep disorders and abnormal sleep patterns. I'm going to go into a little bit of detail of why I think sleep is important and really what happens if you don't get enough sleep, especially over the long term. And I'm not talking about maybe like a day or a couple of days. I'm talking about months and years. What can occur and what do we tend to see from a clinical standpoint in the office when you're not getting enough sleep. And if I don't know if you know, but like sometimes it's actually difficult to control your blood pressure. Sometimes it may be difficult to control your weight. So we'll take a listen to this episode, especially for those who are suffering from sleep disturbances, to see if you meet some of these criteria and see where you can get some help. And I'm also going to give you some tips at the end on how to improve your sleep function today. So we're going to be talking about sleep. Something that I see in my office quite often, and what problems we're having. So let me just give you a quick rundown of some of the issues that we kind of run in with when you don't get enough sleep. So when we don't get enough sleep, we know there's concerns of trouble controlling your appetite. When you don't get enough sleep, we know productivity, especially at the workplace and school, suffers. You're going to hear all of these people who will tell you about this whole I don't sleep, I hustle all night. That does not work. It's been proven over and over and over again. Hey, Yossi. Hello, everybody, for joining. We're talking about sleep today. We're giving some tips on how to improve our sleep here today. And so let's start out. So again, with problems with when you don't get enough sleep, we know you have trouble losing weight when you don't get enough sleep. We know there's actually heart-related issues when you don't get any sleep as well. So definitely something I deal with on a consistent basis. I have a lot of my patients who are diabetic. I have a lot of my patients who have high blood pressure. A lot of my patients who have high cholesterol. And regardless of the amount of medications that I give them, I know that if they're not getting in enough sleep, their body does not have enough time to rejuvenate and process the medication that they do take. So it's always going to be difficult to actually control in that regards. And let me just give some facts that I got. And these are actually from the National Sleep Foundation. Just some quick facts on sleep and all the problems we have. 6 out of 10 health professionals like myself don't have enough time to talk to you guys about sleep. So majority of the time you're going to your doctor's office and they're not even really asking you about like how well are you sleeping. And that's for me, for my patients to understand, they know that I ask them all the time because I know how important sleep is. Wag, what's going on, bro? I know how important sleep is, just kind of moving forward. And again, me as a proficient, again, I don't even get the amount of sleep I should be getting. As an adult, we should be getting about 6 to 8 hours of actually good restful sleep. I don't. But again, it's definitely something I do preach to my patients to go ahead and get. We know 8 out of 10 people actually misuse their sleep medications. So I got a lot of patients, unfortunately, who have to take medications to go to sleep, which is, of course, a problem because majority of your medications do have a lot of addictive properties with it. So after a while, if it took 1 pill to help them go to sleep, all of a sudden now it takes 2 pills to help them go to sleep. And if it takes 2 pills to help them go to sleep, now they add 3. So that's where problems start arising when we get in trouble with these sleep medications. So, of course, my first number one goal is to try to avoid medications at all costs because I know maybe not in a year, maybe not in 5 years, but I know eventually that medication that you're taking right now is not going to be enough to help you get to sleep. So definitely we tried a lot of conservative, hey, Dr. Tracy, a lot of conservative treatments to try to get you guys to fall asleep much quicker. We know one of the primary causes for a lot of especially my couples not sleeping is snoring. So if you have that one partner who snores extremely loud, if you don't get a chance to fall asleep before them, we know you're staying up for hours on end. So a lot of times I have a lot of couples who actually have to sleep in separate beds because the snoring is so bad, and the one partner, it's usually the male who snores a lot, the one partner can't get any sleep if they're in the same room. So I got patients who sleep in separate beds. I got patients who sleep in separate rooms because of the severity of sleep in that regards. We know that as well as the productivity, we know that studies have shown that upwards of 30 to 40% of people actually drive cars and during the day drowsy, have actually fallen asleep while driving. Because it says he snores a lot. Yes, snoring is a big thing, and snoring is we could actually do a whole talk on just snoring aspect as well. But a lot of it is anatomical. But I have a lot of my patients, I have a lot of heavier set patients as well who deal with issues of like sleep apnea, and that's a whole nother conversation in itself, which causes a lot of medical issues and concerns with sleep apnea. But a lot of people just have like general snoring. A lot of it is usually positional. Like I have a lot of my people sleep on their back, and because when they sleep on their back and their tongue rests and it kind of falls in the back of your throat, and then all of a sudden the snoring kind of kicks up. So a lot of times my patients have to sleep on their side, to get a good sleep and not have to snore as much. But again, if you're used to sleeping on your back, me telling you sleep on your side and sleep on your stomach is probably not going to happen. So a lot of it is positional, but there is some anatomical concern, especially when we're dealing with sleep, especially when we're dealing with snoring in that aspect of itself. So let's talk about some tips on how to improve sleep. One is the schedule. Like a lot of us have terrible sleep schedules. A lot of us will go to sleep one day, they're going to sleep at 10 o'clock. Next day, they're going to sleep at 12 o'clock. Next day, they're going to sleep at 2 o'clock in the morning. So for the first thing, all of my patients I ask, what time do you normally fall to bed? Because we need to kind of get you guys into a routine set schedule where if 10 o'clock's coming, that's what I'm doing. I'm going to sleep, and that's about it. Because we know if your body has to kind of get used to the thought of falling asleep. So going inside the bedroom is extremely important on a consistent timetable. Because again, and I'm not talking about my weekend warriors. Of course, on weekends you can sleep in a little bit later. But if you consistently are sleeping at very abnormal patterns, your body has no chance of trying to get a good proper sleep schedule. Hey, Chelsea. We're talking about sleep, and I'm actually going through the 5 tips on how to improve sleeping today. So number 1, get you a good sleep schedule. Number 2, we got to get a better relaxing bedtime ritual. A lot of us, and this isn't just kind of pointing to one person, but a lot of us bring a lot of stress and all kinds of stress from the work, stress from home, stress from family into the bedroom. And when we're going to bed, when we're ready to fall asleep, we got to kind of leave that to the outside. So if you need to light a candle, if you need to listen to, a couple, jazz music, something to kind of get you in the mood for fall asleep, that needs to be done ASAP. We have to find some type of ritual going forward that you can kind of stick to. Again, so one, we're sticking to the ritual of actually going to sleep at a certain time. And the second, we got to get some type of ritual. Again, a lot of us have to leave the stress like outside the bedroom because again, if you're thinking about all the work you got to do tomorrow, if you're thinking about all the work you didn't do today, you're not going to have any chance to go to sleep, especially at a proper time. And again, for most adults, 6 to 8 hours is really our sweet spot for trying to fall asleep and actually getting a good restful sleep. In that regards. And number 3, this is going to be big, especially for, I know my wife gets in trouble a lot, like avoiding naps. A lot of us, if we have the chance, a lot of us do try to get in a quick nap during the day, 30 minutes, hour or so. And unfortunately, that kind of messes up our sleep cycle moving forward. So we always, especially my patient, you come into my office, you telling me that you're having trouble sleeping. The first thing I'm asking is, what about your nap schedule? And, how can we eliminate that? Now, of course, I got some people who say that they can't make it through the day if they don't take their nap. And I just say, well, if you take that nap, then you can't complain about not being able to fall asleep at nighttime. So it's kind of like a yin and yang. Either you want want to, take that hour nap and, kind of rejuvenate it, or you got to get your 6 to 8 hours. Me personally, I'd rather you get your 6 to 8 hours at nighttime and kind of be a little bit tired as the day goes on. Number 4, and this is something that I've gotten very familiar with: exercise. Exercise is a very good sleep remedy, and this doesn't matter whether you're exercising in the morning, whether you're exercising right before bedtime. Something I actually don't probably recommend. If you're going to exercise at nighttime, give yourself about an hour or two before you need to fall asleep, because a lot of times we're so hype and so jacked up from a great exercise regimen that we actually can't get to bed right when we leave the gym. So, give yourself about an hour or so in between time before you're actually going to go to sleep if you're going to exercise. But exercise, and that's something that's recommended. Internal medicine recommended, our sleep medicine physicians recommend that as well, to get you a consistent sleep cycle, because again, it just helps the body kind of wear itself out in that regards. Number 5, check your room. And this is big because if for people who go to the hotel, when you go to the hotel, what do they usually have? They usually have those blacked out curtains. And usually you have your best sleep when you go to a hotel. And the reason, and that's something I reckon, that's something very cheap, something we don't have to worry about, from a medication aspect, being, a problem. Getting blacked out curtains can do wonders for you, because a lot of us are very light sleepers. I know myself, I am. So if there's, like a little trickle of light that comes to the window, like I automatically get up, regardless of, I could have been sleeping 3 hours, 5 hours, 8 hours. The second that little sunbeam and light hit me in the eye, I'm ready to get up. Some of my hard sleepers usually don't really have that problem, but blackout curtains are amazing to kind of get you through a good sleep cycle. You don't have to worry about the nighttime popping up and then all of a sudden 6 o'clock, 7 o'clock in the morning you have to get up, even though you probably had a couple hours to get some sleep. As well as the arrangement of the room. Personally, when you're going to bed, you should be going right to bed. There shouldn't be any reading in the bed. There shouldn't be any eating inside the bedroom, especially on your bed. Because again, your body knows. Your body knows, again, you're doing the first thing. You're going to sleep, at 10 o'clock. You avoided that nap. You got some exercise in. But then right when you go to sit in the bed, you're eating, you're watching TV, you're doing 100 different things. Your body internally does not know when to turn itself off. So usually if you're gonna eat, do all those things, like sit in a chair on a desk next to your bedroom. Don't actually sit in your bed to do so. And again, I know it's difficult for a lot of people, because a lot of people, that's what they do. They usually do their homework. They usually are reading or usually watching TV while they're sitting in the bedroom. And that's something that, again, our body doesn't, from a routine standpoint, has a lot of trouble trying to regulate when we're going to go to sleep. So again, so our last one's definitely our fifth tip is definitely, evaluate the room, evaluate the bed, evaluate your mattress. If your mattress is too hard, too soft, you're going to have trouble sleeping. If your pillows are too hard, too soft, you're going to have trouble sleeping. So it's a whole process into trying to get you some sleep. Something that, again, I think is extremely important, and it's very easy to do. And again, because my goal is to try to prevent you from needing medications to have to go to sleep. And again, because a lot of us take, certain medications that kind of keep us up anyways. So then you take a medication that keeps you up, and now you got to take a medication that has to put you down to sleep. So we try to avoid that, again, especially for my younger patients. Like, I hate to have to give my younger patients sleep medications because they're too anxious, they're too stressed, they're on a different medication that's kind of keeping them up in that regard. So all we can do is try to avoid medication. That's my goal. How can I avoid putting you on some medications to go to sleep? Now again, if you get to the point where you've done all of these things here, you got your sleep schedule, you got your bedtime ritual, you're avoiding naps, you're exercising, you're checking your room out, you're blacking out the curtains, and you still can't sleep. Try some over-the-counter Benadryl. Works extremely well. Even melatonin from a natural, because I know I have some natural supplement people. Melatonin is another medication. For some people, it's almost, it's 50-50 from a study standpoint. Some studies say it works very well for sleep. Some people say, does nothing for them. But, try some over-the-counter Benadryl. See if that's enough to kind of, get you to sleep. But I think personally, if you do all 5 of those things, and you really hit it home. Sleeping shouldn't be a big concern in that regard. So again, just to kind of reiterate, we talked about why we need sleep. We know all of the health risk and problems that arise if we don't get any sleep. We know heart issues. We know controlling your weight. We know controlling diabetes, controlling cholesterol. We know all of these clinical problems occur when you don't get enough sleep. We know, having trouble doing well in school, having trouble doing well in work, falling asleep while driving. All of these are just, problems that kind of compound themselves on top of each other when we're not getting enough sleep. So definitely, please, I don't want you to, brush sleep off. I know, back in the day we used to say, you work 24/7, grind all night, blah, 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 blah. That don't work. Hey, Dr. Michelle, that don't work. That's, we're going to dead that now. We need sleep. I need sleep. 6 to 8 hours for my adults is pretty much our golden window of opportunity in that regards. And for those who that you're still watching, thanks for the support, thanks for watching. Again, continue to like, share everything that we've been doing here with the Lunch and Learns. Yes, not getting some sleep can kill you. And again, it's sometimes you have to say it just as blunt as that. And especially for my young folks out there, my 20 to 30 year olds who are who are doing a lot of partying, who are stressed out, who are working a lot. Understand that again, you may not feel the effects now, but once you get the 30s, 40s, 50s, it will come to bite you.
Thank you for listening to this episode of the Lunch and Learn with Dr. Barry. If you want to find out more about the episode, please go to www.lunchlearnpod.com. That's www.lunchlearnpod.com for the show notes and any links that may have been mentioned in today's episode. If you're interested in joining the Lunch Learn Pod community, head over to either the website lunchlearnpod.com or join us on Facebook and Twitter with the same username, Lunch Learn Pod. And again, you can find all of these links on the website. If you have any questions, any comments, or any requests for topics to debut on the show, please let that be known. And don't forget to use the hashtag LunchLearnPod when you're listening to the episode. Again, I want to thank you for taking the time to listen to today's episode, and I'll see you next week.